Hi, I'm Zach Geller. I'm a postdoc candidate, and I'm interviewing Karina Grossmark today about her course. And I'm going to read a quick bio of Karina before we go into the course and some questions. So just give me a moment. Thanks for being with me today, Karina.
Thank you.
Dr. Karina Grossmark is in full-time private practice in psychotherapy and psychoanalysis in New York City, originally from Argentina. She works with adolescents and adults in Spanish and English. She is on the teaching faculty here at Postdoc and is currently the chair of the Contemporary Freudian track, which she's been doing for 3 years. She is a clinical supervisor in the doctoral programs at City College, at PACE, and also supervises in the NYU postdoc externship program. She also supervises psychoanalytic candidates and graduates. Karina has a special interest in working with early mother-childhood dynamics and trauma in co-ed mental states, psychosomatics, and multicultural and community psychoanalysis. She has written psychoanalytic articles and books and reviews and presented about early psychic development, clinical process, secrets, and working with unrepresented states and international psychoanalytic perspectives. Okay, so we can get into it. We can get into your course a little bit. I thought we could start with just telling us about the course and what brought it about as you were observing what candidates wanted and needed and how you built the course in the first place.
Sure. What made me think of this course originally is that I find in my work that more and more we are meeting patients who really struggle to stay with their affect, to think, to let anyone in the way that meaning can be made of their experiences, and that it is often difficult for us to feel like we can really connect with the patient in a way that we can have an impact. I feel that these are patients that we all struggle with. They tend to elicit strong countertransferences because they tend to communicate via action more than symbolically. These are patients who elicit in us countertransferences of feeling overwhelmed, unable to think ourselves, sometimes really impatient, dissociated, just really struggle to feel like we can make meaning and integrate what the patients are bringing in. So we don't feel like we can have an impact. And just to say a little bit about what is it that I'm trying to say, I think these are patients who tend to communicate via action in the sense that they somatize, they communicate through having deep states of panic and feeling overwhelmed. They have addictions. They struggle with very severe despair, ongoing despair, states of rage, patients who have great difficulty allowing anyone in and connecting to their affect, and therefore sometimes they have very severe destructive and self-destructive tendencies, sometimes suicidal ideation. So these are patients who elicit strong countertransferences on us. And so my hope is that the course will really get to look into what's beyond the symptoms, what's beyond the manifestations in their relationships, but really what's at the root of some of these tendencies. And you look at the syllabus, hopefully, and have a better sense, but I find particularly helpful to think of Andrew Green, who is especially influenced by Freud and Winnicott, and his concept of psychic voids and absences and states of empty and empty depression, and just in general, the work of the negative. Some of these experiences of voids that we in the class hopefully will have a clear understanding of. How do they manifest themselves? Where do they come from? How do we work with them? These are concepts that feels to me are very elusive. Patients don't necessarily have ever thought or named these experiences. In fact, if you ask them, they wouldn't necessarily feel that they had absences, but primarily people in their lives who were extremely physically present and perhaps demanding, intrusive, action-oriented, controlling. So this whole experience, deep, very meaningful experiences of voids and absences is very unsymbolized, really, unrepresented in other terms. And how to access them is not easy. And the class is really organized around making meaning of that and working towards understanding this both from a theoretical perspective and how do we actually deal with these patients and these states.
You know, when you were talking about the countertransference experiences for the therapist, I was thinking this must be the kind of course where the candidates, as you're starting to talk about the types of patients and you're reading the material, that there's a sense of relief and real desire to talk about it with other candidates and to learn from you about it, because it's, I think it's an urgent feeling, that countertransference feeling.
Yes. Yes, no, it's actually it's really a pleasure to think and work with candidates who are colleagues, and to think with them and to hopefully learn, mutually from each other. When candidates and I found incredibly enriching when candidates
Yeah.
every class um, work towards bringing their experiences because they are very present and even interactions of the day, which makes the class be very alive and for us to think together. So it definitely is most important to think about where the patient is at each moment and how do we help these patients make meaning of their experience and how do we contain some of these experiences which are overwhelming.
Yeah. I thought I would ask you one more thing before we stop, which was just about the syllabus and the hits. So you mentioned Andre Green when you were talking, but I thought maybe candidates would like to hear, even though they can read, who are the sort of big figures that they'll be reading during the course too.
Sure. Thanks for the question. Yes. So, you know, these patients obviously range on a wide spectrum. We have patients who are more on the neurotic realm. Some of them are more in the pre-psychotic or psychotic level of functioning. And so one of the things I hope the class will start with, and the syllabus will be a bit different from last time, is that I want to make clear and think together with the class about the differences between what are we talking about when we're talking about patients who are in the neurotic realm and what are we talking and dealing with when patients are more on the psychotic realm. How do we meet these patients in the moment to moment when they're in one state or another is very different, and how they can or not make use of our interpretations or observations or comments is very different. So understanding where patients are is going to be very important throughout the class. The first class also will be focused on beyond and what does thinking mean, or the absence of. What does happen when thinking is not happening? What has unfolded developmentally? How do we work with that when patients struggle to think or cannot think? When we cannot think. So we'll be talking about beyond and thinking. And another point that the class starts with that I think is important is Symington's concept of the trauma of absence of reverie. And what happens when patients have not had that reverie that comes early on from the parental ability to make meaning of the affect and state, contain it. But just to talk about the higher, most salient, just to mention a few, because there is a syllabus that you can look in more detail. I will be expanding on Andre Green, and some of the analysts who have elaborated and developed Andrew Green's thinking, like Howard Levine's concept of representation and non-representation or weakness. Gail Reed, who talks about the empty mirror. We will be thinking about the issues with time in these kinds of patients, timelessness and spacelessness. And for that, we'll be reading Scarfoni and Shelley Bach, who talks about psychic death. We'll be also be reading the Botellas, who speak about figurabilité, and that implies working towards representation that is not just in words, it's very sensorial. And how do you access that, and how do you stay with that is not only verbal but non-verbal, especially. So hopefully that captures a little bit.
I think if anyone wants more, they've got to take the class. I think we did it. Thanks for giving the time to the candidates to hear about the class. And if they want to do it, they got to do it. It's this fall. It's going to be offered, so you can enroll now. Okay. Thanks for doing it today.
Thank you, Zach. Thanks
okay.
so much.
Bye.